For the last 19 years, the Maine Health Management Coalition has brought together employers, providers, insurers, and patients to work together to improve the value of healthcare in our state. 2012 was a year of remarkable growth for the Maine Health Management Coalition. It was a year where we saw the work of the last 18 years really come together. One of the biggest leaps forward was the expansion of our data department's roles and capabilities.
The Coalition's data department took on a whole new level of importance in 2012, and it's become a major resource for the quality and cost work we're doing here in Maine. Over the course of the last year, we acquired an all-payer claims database that includes data on over 90% of the claims in Maine, and invested heavily in updating and strengthening our database of provider information. These tools have allowed us to offer real, actionable advice to members that are engaged in cost and quality initiatives around the state.
The role of data as we begin to transform the healthcare system is really critical to us here at Midcoast, and I'm sure every other health system throughout the state and country. I really feel like it's the holy grail right now as we're all learning together how to get the best data, how to analyze the data, and how to understand it in order to transform care.
We've received a number of very important reports that allow us to do our rating, that allows our actuary to look at our claims projections, and really zero in on some of our individual cost drivers.
One key goal for 2012 was to encourage the adoption of value-based insurance design by one of our employer members. Value-based insurance design uses cost and quality data to create an incentive-based insurance model where employees are rewarded for using high-quality, low-cost doctors and hospitals.
The city ended up choosing a value-based insurance design plan after the comprehensive education modules that our committee went through and reviewed. Members really liked the idea that we were going to focus on outcomes, that we were going to throw the dollars where they present high value, so we'll be covering preventive care at 100%, chronic care at 100%. We're going to introduce generic RX at 100% for certain chronic conditions. Members like that idea that we're going to invest not only for outcomes in terms of health insurance claims, but thinking about our population and productivity at work.
In October, the Coalition launched a new program called CEO Champions to engage CEOs in promoting wellness at their workplaces. Studies show that CEO buy-in can make or break a wellness program, and it was our hope that endorsing a top-down approach would lead to better results.
I think it's important for leaders to model the behavior that they're looking for from the associates. I'm a firm believer that you can't ask others to do something that you're not willing to do yourself.
Well, I think in almost every initiative in every organization, it's important to have the boss because it sets the tone, and it also really conveys to every employee that it isn't just an administrative program. It's really an imperative.
If I show that I believe something's important, other people tend to pay attention to it. It's just, I think, the nature of what happens in leadership. So it is, I think, leading by example in this case is very important.
In December, the Coalition hosted its annual symposium on healthcare improvement at USM in Portland. The event drew people from around the state to hear from experts like Paul O'Neill, Christine Castle, and Jerry Noyce.
My overall impression of the 2012 Coalition Symposium was just that it was invigorating. It brought new ideas. It confirmed a lot of thoughts that I was having, especially around quality and some of the next steps that we needed to take in our organization. It was also delightful to see the mix of different people there, which is always the benefit of the coalition. Being able to talk to people from businesses, from the payers, and from other organizations.
In the winter of 2012, the Coalition convened its second executive summit to review the findings of the Healthcare Cost Work Group. The summit brought together over 50 senior executives from hospitals and health systems, public and private employers, state government, health plans, and community organizations to identify strategies to improve the value of healthcare in Maine.
And I remember looking around the room at one point thinking to myself, there's a lot of horsepower in this room. If the individuals in this room, like the CEOs of hospitals, some of the largest employer purchasers in the state, the leadership from the health plans, the commissioner of Health and Human Services, can't make this happen, can't come together and work on ways to improve quality and cost in Maine, then it's not going to happen.